Stomach bugs are usually caused by viruses and sometimes bacteria and occasionally parasites. People will experience vomiting, diarrhea, stomach cramps and can feel quite sick with them as well. Usually with food poisoning, the symptoms will come on quite quickly, usually hours after eating or being exposed to a certain food. Usually with a stomach bug, the symptoms might develop over a day or so. Most stomach bugs will usually last 1 to 3 days, with symptoms of feeling a bit more tired, lasting a little bit longer. So you should see your doctor if you've been experiencing symptoms for over 2 to 3 days that aren't improving, particularly if you're having fevers or if you've noticed anything unusual in your poo or vomit like blood or mucus. Yes, it is possible to catch the same stomach bug more than once, particularly if it's a different virus that has caused it or your immunity has worn off. So again, we would always encourage good hand washing. So usually stomach bugs are spread through traces of vomit or poo being passed on through person to person, and that can be through contact hand to mouth, sharing drinks, or not washing your hands properly before preparing food or wiping down surfaces. Yes, things like norovirus can live on door handles for days, but sometimes up to 2 weeks if they have not been cleaned properly. Yes, so people can spread symptoms the day before they become unwell and even up to days after they've felt better as well. So people are mostly contagious whilst they have the symptoms and up to 2 days after the symptoms have all cleared as well. But sometimes these can hang around a little bit longer, particularly in younger children who attend nursery. Yes, as long as you're not unwell, it is safe for you to go to work as long as you're practicing good hand hygiene. However, if you have symptoms, then no, we would discourage you from attending work. Yes, this can happen with things like vomiting if particles have then landed on surface areas that haven't been cleaned properly. So again, we would always encourage wiping down surface areas and airing rooms where it's possible. So most stomach bugs don't affect pets and vice versa. However, there are things like parasites that can be passed between human to pet. So again, really good hand hygiene and washing your hands if you are touching your pets or any other animals. So we would say to wash your hands with soap and water, stay at home if you're feeling unwell so you're not passing on the germs. If you can wipe down your surfaces regularly, we would encourage that, and airing rooms out where you're able to. Not always, and some hand sanitisers don't work well against certain viruses, so that's why we would always encourage to wash your hands with soap and water. So yes, we would say it's probably best to avoid anything that's raw or undercooked and unwashed fruit and vegetables. And if someone has been unwell recently with a stomach bug, I would avoid eating food that has been prepped by that person. Yes, so stomach bugs like norovirus are more common in winter, and that's primarily because we spend more time indoors in the winter. So in the summer, where we have lighter days, warmer days, and the windows will be open, that will encourage breeze. So any virus that might be airborne, there's less chance of it being kept indoors. Whereas in the winter, where it's colder, we will have the windows shut, and so therefore the opportunity for those viruses to escape outside is less often. Yes, so these groups of people can become more dehydrated quickly and can suffer from more extreme symptoms, so we would always say that they should seek medical attention much sooner. So if your baby or toddler has a stomach bug, the most important thing you can do is keep them hydrated. So encourage them to drink lots. We would say little and often, and it's really important to keep an eye on how much they are weeing as well. Or if they have extreme tiredness or dry lips, we would say to seek medical attention. So we would say to try bland foods like toast, rice, crackers, and what you should really avoid would be fatty foods, spicy foods, and things like sugary foods you should also avoid until your stomach settles and you're feeling better. So it's really important that you're drinking lots when you have a stomach bug. So we would say plenty of fluids, little and often. Hydration salts can be really good too. And in toddlers and smaller children, we would encourage ice lollies if you're struggling to get them to drink anything. So norovirus is the most common cause of stomach bugs and can spread quite quickly. Rotavirus is more commonly seen in children and babies, but with both you will experience vomiting, diarrhea, feeling sick and stomach cramps. No, so usually most stomach bugs are caused by viruses and antibiotics will treat bacterial infections, so we would say no. So it's really important that you clean bathrooms, toilets and surface areas with disinfectant and bleach. We would also encourage that any towels or bed linen that's been used is also washed as well. So we would say to wash your clothes on the hottest setting that the label advises. It's always really important if you have handled, soiled or dirty clothes that you then wash your hands after loading up your washing machine. Yes, so vomiting can send particles into the air. So for example, if you were sat next to somebody who was sick, some of those particles may land on a surface area next to you that you won't be able to see. So therefore it's really important to clean up the vomit straight away and disinfect the area thoroughly and as soon as possible.